It's a disease as old as civilization, yet today it still kills over 1 million people every year. Tuberculosis, or TB, is highly infectious, potentially deadly, and in many places still misunderstood. What causes it? How do you know if you have it? And can it really be cured? Hi, I'm here to talk about all things health. Tuberculosis is a contagious infection caused by the bacterium Mycobacterium tuberculosis. It most commonly affects the lungs, but it can also damage other parts of the body, like the spine, kidneys, or brain. TB spreads through the air. When someone with active TB coughs, sneezes, or even speaks, they release microscopic droplets containing the bacteria. If you inhale those droplets, you could become infected. There are basically two types of tuberculosis infection: latent and active. Latent TB infection, you have the bacteria in your body, but it's inactive. You feel fine, you're not contagious. But without treatment, it can become active later. That's why it's important to get tested if you're at risk, such as healthcare workers, prisoners, or people living in refugee camps. Also, anyone who's in close contact with someone who has active TB, TB can be particularly aggressive in people with HIV. Signs of active TB may appear slowly, over weeks or even months. Here's what to look for. A persistent cough that lasts more than 3 weeks. Coughing up blood or sputum, chest pain, fatigue and weakness, unexplained weight loss, night sweats, fever and chills, and loss of appetite. The problem is these symptoms can mimic other illnesses like pneumonia or bronchitis. That's why early testing is so important. Before one is diagnosed to have TB, he or she must have done the test below. The TB skin test, also known as the Mantoux test, a small amount of tuberculin is injected under the skin. If a raised bump appears after 48-72 hours, it may mean exposure to TB. The second blood tests, these detect immune response to TB bacteria. Useful, especially if you've had a BCG vaccine. The third, chest X-ray to detect lung damage or signs of infection. The fourth, sputum test. Your mucus is examined under a microscope or sent for culture to detect TB bacteria. Doctors often use a combination of tests to confirm a diagnosis, especially in complicated or drug-resistant cases. If someone is diagnosed with TB, the good news is tuberculosis is treatable and curable. But the treatment is long and requires commitment. First-line TB treatment is isoniazid, rifampin, ethambutol, and pyrazinamide. These medications are usually taken daily for 6 to 9 months. Skipping doses or stopping early can lead to drug-resistant TB, a much more dangerous form that's harder to cure. MDR-TB and XDR-TB require more toxic drugs, longer treatment times, sometimes up to 2 years, and have higher failure rates. The key to ending TB is prevention and control. Early diagnosis and treatment of active cases, use of surgical masks in hospitals and clinics, BCG vaccination for children in high-risk countries, good ventilation and hygiene, and screening of high-risk groups. If you've been exposed or are at risk, talk to a doctor about preventive therapy, even if you don't have symptoms. Let's recap. Tuberculosis is a serious bacterial infection that spreads through the air and most often affects the lungs. It can lie dormant or become active and dangerous. With proper diagnosis and long-term treatment, most people fully recover. But global awareness, early detection, and responsible treatment are our best weapons. If you found this video helpful, hit that like button, share it with others, and subscribe for more health deep dives. And in the comments, let us know, have you or someone you know ever had TB? What was your experience like? We can break the stigma and stop the spread. Thanks for watching and take care of your lungs.